Hello, everybody. I'm one of your classmates, and today I'm gonna be talking about different muscles of the body and what the importance of them is. To know the importance of a muscle, you first have to study its location, the spelling, the origin, insertion, primary action, like what movement does it do, and what nerve supplies it. Also, the amount of nerves, because larger muscles require more nerve intervention, right? So the first muscle we're gonna be looking at is the gluteus maximus, which originates in the posterior aspect of the dorsal iliac posterior to posterior gluteal line, and the posterior iliac crest, posterior inferior aspect of the sacrum and coccyx, and the sacrotuberous ligament. The insertion primarily is in the fascia alta at the iliotibial band and also into the gluteal tuberosity of the posterior femoral surface. The action of this muscle, which is our biggest muscle in the body, is the major extensor of the hip joint, and it assists in the lateral rotation of the thigh. The upper and middle third section of the muscle are abductors, right? The innervation is innervated by the nerves, the inferior gluteal nerve, and that's located in L5, S1, and S2. Arterial supply is supplied by the inferior and superior gluteal arteries, and the first performing branch of the profunda femoris artery. So again, this is the largest muscle in our body, and it's pretty great because it attaches to the lateral side of your leg, to your IT band, and therefore it helps you rotate, not also abduct and flex. It's a crazy muscle. Next, we have the gluteus medius, which is originated in the dorsal ilium inferior to the iliac crest. The insertion is the lateral and superior surface of the greater trochanter, and the action is a major abductor of the thigh. Anterior fibers help to create a rotation of the hip medially, but the posterior fibers help rotate the hip laterally, right? Innervation superior to the gluteal nerve is supplied by the L4, L5, and S1 part of the gluteal nerve. And the arterial supply is by the superior gluteal artery. It's a smaller muscle, therefore it requires less intervention and less supply of blood. The gluteus minimus is, of course, the minimus, just as its name says. So this is what we're going to study next, right? The names and what they mean. So maximus means large, mediums means medium inside, and minimums means very small. This one is the deepest one of them all, and is originated in the dorsal ilium between the inferior and anterior gluteal lines, also from the edge of the greater sciatic notch. It's inserted on the anterior surface of the greater trochanter, and the action, it abducts and medially rotates the hip joint. It's innervated by, again, the gluteal nerve, and it's in L4, L5, and S1. And the arterial supply is supplied by the superior gluteal artery, of course. The next muscle we're going to talk about is the lateral rotators of the hip, and the first one is the piriformis, which is originated in the anterior surface of the lateral process of sacrum, that's all the way down here, and the gluteal surface of the ilium at the margin of the greater sciatic notch. It's inserted at the superior border of the greater trochanter, and its action is the lateral rotator of the hip joint. Also helps abduct the hip if it's flexed, and is innervated by the piriformis nerve located at L5, S1, and S2. The arterial supply is the superior and the inferior gluteal and interior pudendal arteries, right? And as you guys know, I have pictures for all of this, and I'm gonna be saying everything in the order that I put it on the slide, on the information base. Next, we're gonna be talking about gemellus superior, whose origin is in the ischial spine, and its insertion is in the medial surface of the greater trochanter of the femur, and in common with arbitrator internus. The action rotates the hip, rotates the thigh laterally, and it also helps abduct the flexed thigh. Innervated by the nerve to the orbitator internus or the nerve to the quadratus femoris or both, depending on what situation. And it's innervated by L4 and through S1. Arterial supply is the inferior gluteal artery. Okay.